my mission to start out with, even was to just explore the idea of what health is, because I got involved in a health tech project where that kind of kept coming up. Like, how do you engage people in some practice that helps them have some sense of what they're actually trying to achieve? And I know that's probably a big part of your work day to day too.
Absolutely. Yeah. I mean, and it's kind of like a GPS, right? Like you need to know where you are, you need to know where you're headed, and then you
Yeah.
map out a route to get there. And like
Yeah.
that's different for everybody depending on their own situation,
Right.
and yeah, I mean, and sometimes, yeah, I mean, but more complex than mapping, right? With a GPS, we have our own biases, right? Like maybe it's towards alternative medicine, or in your case, towards craniosacral, in my case, towards herbs or naturopathic approaches, which may not always be aligned with what, the right
Right.
route for that particular person. So yeah, there's a lot of complexity there for sure.
Yeah, and that's what I think needs to be parsed out a little bit more. And I think we're just getting to a point where people are so frustrated with health system approaches that they're having to advocate so much for themselves and learn so much for themselves. But where do you go for that information? And so,
Yeah.
I mean, as we were talking before, you're interested in doing a podcast. Your take is going to be a very unique approach, and anyone who's interested in what you've been doing, either your patients or anybody who's interested in products that you're developing, are going to be interested in what's behind all of that. So that's kind of what I want to get in with to with you today as well.
Yeah,
So,
let's
so
do it.
where are you located?
I am in Connecticut.
And
Yeah,
and what part?
just up the road from Yale. I live in Hamden, Connecticut, which
Oh
is
yeah.
New Haven County.
Yep.
Our claim to fame is pizza. A pizza, which starts with an A here. A pizza
Okay.
uh, is what the old Italians here. We are a large concentration of Italian Americans in this state and in this city, and we are
Yeah.
just awash in pizza. The best pizza in the world, according to lots of people.
Yeah.
So that's
Well, I lived in Carroll Gardens in Brooklyn for been there on and off for 20 years. So they would argue because and I know there's a lot of conversations about it's about the water from New York or New
right,
Jersey
right,
or
right.
Connecticut that makes the pizza. So
I don't know. Yeah, right. The water. They say the same thing about the bagels in New York City too, right?
yeah,
No
yeah,
one seems to be able to reproduce them. Something in those New York City water pipes. I don't know. Yeah.
yeah. So I had somebody actually come into my office this week and ask me, what's the schooling for a naturopath? So is that something that you can explain to us so we kind of understand what a doctor of naturopath medicine is?
I certainly can, and I wish that it was a really simple answer, but it's more complex. You be careful what you ask, right? But yes, I'm
Yeah,
certainly happy to address that. It's an important subject actually, especially for public safety,
yeah.
and just public health in general. So absolutely, we can talk about that.
Where did you do your schooling? I know
I,
I looked into it at one point. I know there were only a couple of schools at the time, but where
yeah,
where,
so
where did you go?
I went to Bastyr University in Seattle.
Gotcha.
Um,
Yeah.
And, just yesterday, there was an announcement that Bastyr University in Seattle, which also has a satellite campus in San Diego, happens to be my hometown, um, and National College of Naturopathic Medicine, I think that they call it National University, NUNM, National College, which is in Portland, Oregon, are
Okay.
merging. Just
Ah,
news yesterday. So those two schools, and I'm actually quite honestly not sure how I feel about this. I think it's probably a good thing for the profession. But yeah, those are the two, I think, biggest schools, certainly the most well known, and they are merging as of yesterday. So
probably for financial reasons. I'm guessing as a lot of
yeah,
schools are kind of going through a lot.
the announcement was coded in all kinds of positivity, right? Like,
Yeah.
it sounds like, this is, stronger together, this kind of thing.
Yeah.
And that was the marketing of it. I hope it's true. I don't
Yeah.
really know. I'm not as dialed into the whole like institutional side of naturopathic medicine as I once was, but
Yeah.
we'll be investigating. Again, the announcement of this merger just was yesterday, so we'll have to see what happens.
So did you do an undergrad before you went there?
I did, yeah. I went to UCLA, and I studied neurophysiology.
Okay.
I'm happy to share with you the origin story there, how I went from like a kid who wanted to be a sports medicine doctor, an
Yeah.
orthopedist,
I'm
into
curious.
becoming Yeah. Well, let's start there. So, yeah, I grew up in sunny San Diego, California. I was like a rough and tumble kind of surfer skater kid, and
Hmm.
broke lots of bones, lots of fractures, sprains, and strains. You know the deal. Like spent
Yep.
much of my
Yep.
childhood in casts and braces of various sorts. Um, anyway, I took this idea that I wanted to be a doctor to UCLA, which is where I did my undergraduate studies in neurophysiology. And at that time, my dad is a PhD in psychology and was training medical residents at UCLA at the time in psychology as relates to primary care medicine. So
Okay.
I had kind of like maybe backstage access to a lot of doctors in the UCLA
Yeah.
system at the time.
Yep.
And they were all, maybe surprisingly, very discouraging of a career in medicine. This is like almost 30 years ago now, 25 plus years ago. Increasing influence of big insurance, increasing influence of big pharma, all the sort of things that have come to pass now that I think are really crumbling our current healthcare system.
Yeah.
They were sort of predicting and saying like, I don't know if you want to go into that, you know?
Yeah.
Anyway, what's a kid to do? I thought I was going to be a doctor. These guys, I was taking their advice. Anyway, I took off for a year, and I went traveling around, you know, wearing a backpack and sleeping on beaches and hitchhiking and that sort of thing. And on that trip, I wound up getting an infection on a blister that I had on my foot. It turned into cellulitis in my leg, and it was very serious
Oh
problem.
yeah.
Cellulitis
Yeah.
is a limb threatening, even life threatening problem. Anyway,
Yeah.
I was in Switzerland at the time when this happened. I got a prescription for antibiotics, which I needed, called into a pharmacy in Zurich, Switzerland. And
Mhm.
I went in there, and in there, I saw all this herbal stuff, right? Like, you know, homeopathics were in there,
Yep.
tea, you know, all this natural medicine stuff, which is just part of routine primary care there, right? Like they practice according to a ladder, a hierarchy of therapeutics that we would do well to
Yep.
learn from here.
Yep.
And I needed my antibiotics. I got my antibiotics, and they cured my infection, which was great. But that experience in that pharmacy opened my eyes up to this world of natural medicine, especially the herbs, which, you know, lit a fire and a passion that's really like still burning now.
Yeah.
And so that's kind of that's my story. That's the origin story. I took that, you know, experience, learned about natural medicine, found out about naturopathic medicine. That carried on my travels to all of the schools of naturopathic medicine in the country, settled on Bastyr in Seattle, which is a wonderful place, and did my 4-year naturopathic doctorate there. So that's the
Interesting.
origin story. Yeah.
Yeah. I mean, I've a little bit of a similar story as far as beating my body up in sports, being younger, and then starting to have a lot of back problems in my teen years and got really bad in my 20s. So I kind of went that route too. But interestingly, like your point of view with Europe, you know, my field, craniosacral therapy, really was developed out of an old osteopathic tradition, which was developed in the United States, but then jumped to Europe and became very popular. So they picked that up from us, and then it kind of disappeared from you know our approach to medicine for a long time. It's making a return. In fact, I think even a lot of chiropractors are being trained in these more subtle, you know, low force techniques.
Yeah.
Because it's safer, for one thing.
Yeah, sure.
With you know liability and stuff, but also I think we're starting to learn a lot more about how the nervous system processes and you know how it's able to sort of you know work with that manual therapy. So
Yeah.
that's interesting. And also with the naturopathic approach, I find, especially from living in New York, that people, you know, because it's such a melting pot there, I've worked with people from all over the place, and it seems like people from Europe, people from South America, and a lot of kind of Caribbean islands and Africa and stuff, all kind of, you know, grew up with these traditions of using herbal products. My wife's Russian as well, and her family still uses all these things
Yeah.
that are just kind of very basic household things. So I always think it's interesting to see, you know, how those things have disappeared from our culture, and I'm sure, going back to the money making part of it, there has just been so much money to make in this approach to that pharmaceutical care.
Yeah.
So was that something that was there something about that kind of care that kind of went against your belief system? Is that why you kind of looked more to the herbal products?
I think so. Yeah, you bring up a bunch of really interesting points there. It is fascinating, right? That in the United States, there's this. I think of it kind of like a seduction of the new or the sexy, if you will,
Yeah.
right?
Oh,
Like
that's
it's
a
like,
great way to think
you
about
know,
it. Yeah.
and it's like there's a metaphor here I think of sometimes in music where like we have an evolution of the different products that we use to consume music. Like, let's go vinyl records, and then we go maybe 8 tracks, and then cassette tapes, and then CDs, and now, MP3s, right? And in America, we have this idea that, like, okay, the new thing comes out, let's just get rid of the old thing. Like, I'm sure many of your listeners can relate to this. Like, when did you get rid of your cassettes? When did you get rid of your CDs? We just get rid of the old one. Whereas in other places, almost everywhere else, there's like kind of remains an appreciation for the vinyl, for the 8-track, for the cassette, and all that old stuff is still, believed to be valuable. And here we like throw it away, and then like 50 years later come back to it and like, oh wait, vinyl records are actually cool, like, and that's I think what's happening now with natural medicine, whether it's craniosacral, herbal medicine, or otherwise. It's like this return to like, oh wait, that old stuff, be it vinyl records or St. John's wort, is actually cool and actually works. And like now it's kind of retro. So and it wasn't for me, it wasn't necessarily like anything so negative about Western medicine. Although I did quite clearly appreciate way back in the day that like Western medicine was it's the dominant system here. There's plenty of practitioners of it. And I just felt like I guess one way to put it is that like when you're thinking about a particular diagnosis, right? Any kind of problem, we could pick any problem. In Western medicine, you arrive at that diagnosis and then the thinking kind of stops, right? There's a menu of options, usually drugs or surgery that are like that flow out when one arrives at the diagnosis. And the way my brain works, the way I'm wired, I was much more inclined to ask more questions once the diagnosis is established. So, it's like, here's the diagnosis. And then the question is like, why? Why do you have this? How did you wind up this way? It's like when the diagnosis is made, that's when the thinking really begins or takes off.
Yeah.
And that attracted me to naturopathic medicine, alongside the attraction of just herbs and plants and the natural therapeutics. I'm a nature kind of guy, so that's what set it off.
And that's the art of medicine, right? I mean, I think I have a good friend who was a doctor who is really frustrated with working within systemic care because they give him a tablet, he has to click boxes to get someone from one thing to the next. And sometimes maybe they've already had a test that they're saying that they need to do again, and it's like they just get so blockaded in all these different ways, when really what he wants to do is ask questions, find the simplest, thing that doesn't need to be a more complex, just because something hasn't, resolved quickly, that doesn't mean we need to go to more complexity. There might just be one more simple thing to do, but the system doesn't always allow for that. So I kind of wonder how much, I mean, what you're doing, I think, is, and what I'm doing is we're getting people who are basically like losing faith in that system approach, because they know they're going to get listened to. They know they're going to get the, we're going to listen to their whole story and try to get a sense of what's going on as a whole and continue to ask questions. Whereas, as you're saying, if the questions stop at a certain point, obviously if I have a compound fracture in my leg, I'm going to the hospital. I'm gonna. Sure. I know that's where I'm gonna get the kind of care that I need for that kind of thing. But when it comes to a lot of the more subtle things that are going on with people's bodies, and there's a lot that can go on, where do you start in that process? And that's where I think it's important to come meet with somebody like you.
Yeah, and yourself too. I mean, I think, and this shouldn't be really alternative, right? I mean, what we're talking about is just like the humanity in it, right? The tools that we're using, and we can get specific about them. For you, craniosacral or subtle bodywork type of techniques. For me, also using bodywork techniques as part of my practice, maybe a little bit more invasive or aggressive, you might call it. But regardless of the tools, right? The herbs, the homeopathics, the acupuncture needle, the craniosacral techniques, it's like people that we're working with. And it reminds me of a story of a patient of mine who was kind of like a very mild-mannered, rather anxious woman who had a whole bunch of different medical problems. And she had waited for a long time to get an appointment with an endocrinologist, a specialist for a specific question that she had. And she waited for the appointment for months because, they were booked out. And then she got the appointment. And then once she got there, she waited for an hour because the doctor was late. And then once she got into the room, it was cold and she was uncomfortable. And the doctor came in like a whirlwind, right? Mm-hmm. With to check all the boxes, and checked a bunch of boxes, adjusted a dose of a particular medication, and then left. And she was kind of overwhelmed by this whole thing and didn't really even realize until she was checking out that she never got to ask the guy the question that she came in for.
Right.
Like the thing that she made the appointment for never came up. He never asked, and he was gone. And she actually told me that she broke down in tears at the checkout desk. Like, it's almost as if something horrible had happened, something sort of did. It wasn't a terrible diagnosis or anything. The front desk lady's like, "What's wrong?" And she's like, "I came in here, I waited months, then I waited an hour, and I was cold and I was scared and the whole thing. And I never even got to ask him what I came here for." I mean, that's a problem. And I don't feel like I should be called a snake oil salesman or an alternative medicine quack just because I want to listen to the lady and hear her actual question.
I hear you.
You know?
Yeah.
Yeah.
So what is it in your field? What did you end up deciding to focus on? Was there a kind of a route that you ended up, within the naturopathic training? Do you have kind of different options in terms of directions you can go in terms of your training?
Yeah. So naturopathic doctors, we joke and say sometimes if there's 5 naturopathic doctors in the room, you could get at least 6 or 7 opinions out of that. Because we are so eccentric and eclectic in the way that we approach things. There's lots of different ways to sort of specialize. And there can be specialties in a modality. So there's naturopathic doctors that really focus on one kind of therapeutic tool, herbs, for example, nutrition, for example, body work, even craniosacral, or some people get dual trained in acupuncture. So that's what I would call a modality specific approach. There's other people who like specialize in a particular population demographic, pediatrics, geriatrics, women's health, et cetera. And then there's people who specialize in disease entities or body regions, endocrine, GI, these sorts of things. So for me, I consider myself a generalist. I again, just sort of the way I'm wired, couldn't ever see myself focusing on one narrow body area for my whole career. So in my practice, it would be, a common problem in primary care, like cleaning earwax out of somebody's ears or something unglamorous like that. And then the next patient would be a severe disabling autoimmune disease or something like that. So kind of, I suppose I could be accused of being, there's the jack of all trades and the master of none effect, but that's the way it worked for me. Over many, many years of practice, it became clear that a lot of people with orthopedic pain, musculoskeletal pain, really benefited from my services. So that just sort of niched me out into orthopedics and musculoskeletal pain just by accident, right? It just sort of happened that way. So I wouldn't have ever called myself a specialist, but I did see a lot of people, in my practice with orthopedic problems and musculoskeletal pain.
Yeah, I think because of my back pain issues and trying to solve that for myself, I became much more interested in the nervous system, especially autonomic nervous system response to things, which in some ways made me a generalist, right? Because I became, I'm also a massage therapist, and I did functional movement work and postural correction work as well. So kind of worked within that physical movement part of things and the body work, which I liked that combination of things. Those are my only tools to use, but I feel like in terms of toning the nervous system or, creating a good base of strength or stability for somebody, I liked having the movement part. I don't do as much these days, but I did a lot of that for a long time. And I felt like that autonomic response, really ties into like endocrine system function and, all sorts of other, cellular activity that's happening because we stay in fight or flight states for too long. And it ends up being part of orthopedics. It ends up being part of pediatric care, oddly enough, because babies who have had difficult deliveries also have a lot of GI and, latching issues. And so that was kind of where my focus went. So in some ways it has allowed me to work within a number of different fields of care. And it gives me perspective too.
Yeah, and as well it should. I mean, I'm remembering now. We were talking about my schooling. This was at Bastyr. This is in the late 1990s. I took a class, and it was an epic class at the time, really forward thinking. And the class was called Psychoneuroimmunology, right?
Oh, yeah.
And that was really neat because it it really encapsulated this idea that psycho, that's the psychological, psycho-emotional, neuro,
Yep.
the nervous system itself, and
Yep.
then the immune system, psychoneuroimmunology. I think that later that class became psychoneuroimmunoendocrinology because now the
Right.
hormonal system's wrapped in.
Yes, of course.
And then like we could add every ology on there,
Oh, totally.
right? And just make this the longest class name ever because holistic medicine, right? Like
That's it.
none of these body systems exist in a silo.
Right.
They're all interconnected. There's inputs and that affect us in positive or negative ways, and all these different biological inputs affect all of our body systems. So I think, I mean, psycho, neuro, immuno, gastro, cardio, dermatologo, right?
Yes.
The
Yes.
the name of that class could be every ology, and that would sum it up, right?
Which I think that's something that we should be trained in just in general in medicine. And I think the more siloed we get, and there's a place for those really highly specialized people as well. But I think they also need to be in this relationship with other people who they're having conversations with that are among that chain of other things too.
Yeah. And I mean, the part of the thing that I think is so amazing about the work that you're doing, at least and I'm talking now about the podcast and reaching
Yeah.
listeners in this way, is because I think part of the responsibility for this revolution that you and I are trying to mount here, right? And there's
Yeah.
people
Yeah.
with us about kind of a refashioned version of what healthcare and medicine can be,
Yeah.
really rests with the patient, right? Because I think that Western medicine and that specialty care system, and you're right, like I've sent people to specialists in thumbs, right? There's hand specialists, but they're over
Yeah.
here, big tertiary care medical center down the road, thumb specialist.
Yeah.
If you have a thumb problem, it's amazing, right?
Yeah.
But you shouldn't think for a second that thumb doctor should be the right person to ask questions about other body parts, right?
Right.
And so there's this, again, with this idea of the seduction, this Western medical system, big pharma, big surgery, medical devices, all that has kind of lulled, I think, the American public into the belief that is the way, right? That is the
Yep.
only way, and that like medical specialists are at the top of the game. They're the cream of the crop. They are the go-to people to consult about any health problem. Take for example, let me just give you an example to illustrate my point. Diabetes, massively epidemic levels of diabetes in this country.
Yeah.
And we have diabetologists now, and they're great. They're in their lane. You would think that if you were an endocrinologist who had subspecialty training in diabetes, you were a diabetologist, that you would know everything or have a commanding knowledge of everything that could be used for the management of diabetes, right? But it turns out that that's not what a diabetologist is. They're an expert in the Western medical approach to diabetes. Yeah. Insulin pumps, all the different kinds of insulin, the medications, that's their lane. They're not that great at diet. Some would argue they're terrible at it. They know nothing about the herbal medicines and the nutritional approaches. They know nothing about autonomic nervous system responses and how that might impact blood sugar or stress. So it's not really a diabetologist. It's a Western medical specialist who's used that narrow lane. And I think that the American public thinks that just because a person went to Harvard or Yale or whatever and studied diabetes, that they know everything about diabetes. Then why don't they know about berberine? Berberine is a very useful blood sugar modulating herb. Most diabetologists in Western medicine know nothing about it. They've never heard about it. So how could they call themselves a comprehensive expert? And that's on us to educate people about that, I think.
Yeah. And I think it's on them a little bit too. I mean, this is one of the things that I'm very fortunate that I think what people tend to come to me, if they're coming to me for regular care, and a lot of times part of the reason I travel for work, still is because these are people that I've probably been treating, a good chunk of them for 20 years or more. So they trust my network and my instinct about things. And sometimes it's just, if I see something different that I haven't seen before, or they come to me with a new symptom that I think is potentially going to cause some problems, I'll try to find a referral for them. And part of it is, especially with, trying to find a mental health person or someone that's like a good physical therapist or, something that's more specialized. It's hard to find those people on your own and just go on your network list and just,
very hard,
point at a name. So this is kind of where I also feel like you and I come in, but also where I think and I have quite a few people who are in allopathic care who also trust me, so I can text somebody in a couple minutes and be like, I have a person, I'm wondering if you can see them, or if you have an idea of who they should go see, or how soon they can get in to see somebody for this, or which
Yeah.
urgent care to go to. Those are kind of important leads to have. And unfortunately, there's this barrier that happens once you're within a system, system approach to care. And I think, if we could be brought into this, bigger umbrella, we could actually funnel things a lot faster, and probably even treat things on the front end to because the sooner you get these things treated, the less impact it's going to have long term, and the better the health outcomes. But we don't get brought in. We're usually last on the list most of the time, right? They've been through
Yeah.
everything else, and then they kind of end up on our office because somebody told them about us.
Yeah, absolutely. It's true. It's sad. And you're right that it is on them to some extent too, for, the Western medical system, that is for just believing or drinking that same Kool-Aid that like Western medicine is where it's at. And it's the
Yeah.
only thing, I think I'm noticing, because I've had a lot of experience over the last decade or so training, preceptoring really, medical residents from Yale. So Yale's right
Oh,
down the
yeah,
road
yeah,
here. And I
yeah.
have a lot of, my whole neighborhood is filled with Yale doctors, many of whom, just because of our interpersonal relationships, have learned about what natural medicine, naturopathic medicine is,
Do
and
you
have,
treat a lot of them?
yeah. I have lots of doctors that come in to see me.
Yeah,
Yeah,
I
yeah,
figured. I mean, I
yeah.
would say probably 25% of my clientele is, someone in the medical profession.
Yeah. Medical professionals for sure. I think that's always an interesting little irony, right? They come in and they don't want to do what the primary care doctors do. They don't want to see themselves, right?
Right.
They want to avoid the drugs. They want to avoid the bigger interventions. Yeah. But yes, lots of medical professionals, conventional medical professionals come into practice for sure. Yeah. And I do think that like there is, I mean, I've been in this field for 25 years. I think that it's the pendulum is swinging, right? The younger
Mhm.
doctors have a more appreciation for it. I think there's increasing dissatisfaction with Western medicine, the way that it's currently practiced, the pricing, the insurance, all that sort of stuff, the heavy dependence on drugs. And I think like as we see things like organic foods and regenerative agriculture and non-toxic sunscreens showing up in people's lives, that shows me that like, wow, that's really didn't even exist. It was like a fringe movement 25 years ago,
Yeah.
and now is becoming mainstream. And I think that's a great thing. And I see that happening as well
Yeah.
in healthcare.
And I think because our demographic is probably smaller, and our subset that we tend to work with, I mean, are usually people who can afford to come see us. I mean, that's the unfortunate thing. But because of that, we end up working with like, I feel like my practice has become almost like small town medicine, because even though I'm going to New York, my community is fairly small,
Yeah.
and there people have been treating for a long time. And because I treat from, newborns, I have a lot of newborns now that I treated who still have come to see me on and off for different kinds of things when they're kids and teenagers, or they might be, on the spectrum, or have a lot of sensory processing stuff. I see them, through into their teen years, and so having that experience now, I can see how we could be smaller in the way that we sort of work with communities, but the unfortunate part of it is that we can't, we can't really um, cut too much out of what we're charging, because we are so small. We're reliant on everyone coming and showing up to their appointments, and we can only see a certain number of people a day. And I don't know how about you, but I see people most of the time for minimally a half hour, and most of the time an hour or more.
Yeah. And naturopathic medicine, and we can talk more specifically about this, is a unique case. Well, as I said, I'm here in Connecticut. So in Connecticut, my state, naturopathic doctors are licensed and regulated by the state, are considered not exactly for insurance purposes, primary care providers, but we're considered physicians by the state. And we've had a lot of legislative challenges in that regard, but we've been a licensed profession for over 100 years actually in
Right,
this
right.
state. naturopathic medicine in Connecticut's the state slogan is the land of steady habits. So we never got rid of the vinyl records here. The naturopathic licensing law is still on the books. But what that means for us here, which is different, by the way, in New York and other states, is that we take insurance. So the doctors at my practice all accept insurance. So we are considered specialists by the insurance, specialists in naturopathic medicine. So people come in, they pay a copay, we do reimbursement, the usual kind of doctor's office sort of thing. So our field is unique in that way, but that very much depends on where in the country you are. So that same situation exists in Washington, in Oregon, California, some unusual exceptions, but mostly, and this is maybe not any big surprise, most of the blue states have naturopathic licensing laws in the books. And in many cases there, you have naturopathic doctors who, accept insurance just like a specialist would. And then in other states where the practice of naturopathic medicine is not regulated by the state, you have a more self-pay situation like your practice.
Gotcha.
Yeah. Oh, and that's a game changer, right? That increases access immensely.
Yeah. So do people come to see you as they would a primary care then? I mean, is that kind of, do you have a big population of that, or are you seeing more people for kind of, specific recovery type care?
Both, right? Again, this jack of all trades thing. In my practice, there are lots of people who come in and use me and the rest of the doctors in my group as their primary, and by primary, I mean the first person that they go to when they have a problem, right? So that's one way. Primary care physician, PCP, is really an insurance designation, and involves having hospital privileges and being on call and stuff like that. So for insurance purposes, no, we're not primary care doctors, but in the eyes of our patients, we very often are. And by that, I mean, we are the first people that they call when they have a rash, when something hurts. We might order an x-ray or an MRI or get blood work or send them to a specialist or something like that. And then we have many people like that. And those are people who are kind of cut from the same cloth like you and I are, right? Like they already kind of eat organic food and they care about their health and, that sort of thing. Yeah. And then we have people that are on the opposite end of that, right? That are they've been through the ringer. They've had multiple surgeries. They have to take tons of medications. Whatever they've been doing isn't working. Someone said, oh, you should go see a naturopath, and maybe give them my name, another doctor in my practice. And then here they come, just a train wreck, on 15 different medications. And, we're just trying to, sort all that out. So it's across the spectrum. Very interesting work.
And do you have something that you prefer to, I mean, are there things that you really love treating that you feel like have become kind of your subspecialties?
I think if there's any one sort of body system, it's the musculoskeletal system. It's orthopedics. That is a big area. I'd probably put GI as a secondary area there too, because there's just so common, so many common complaints, and there's a lot of interface there. And then both of those are very intimately twisted up with the psycho-emotional piece. So I really, I think that, if I had a specialty area or kind of a favorite type of patient to see, it would be somebody who has orthopedic or musculoskeletal pain, gastrointestinal problems, and then all of the psycho-emotional stuff that either is, inputs onto those problems or is part of the output from those problems.
Yeah. With the orthopedic stuff, are they people who tend to be kind of on the healthier side and are trying to do something physically, a sport or an activity that they're being limited by? Does that tend to be your population?
No, I would say, I've often said that I love the idea that patients would come and see me and say, Doc, like, I'm doing great and I just want to keep it that way, or like I want to be able to run faster or something like that. But it turns out that on the ground, in reality, the people that come in are people who are suffering in some way or another, usually with pain that might be disabling, or maybe a serious autoimmune disease, something that is crippling them and making life not livable in the way that they want to live it. And that's what they're coming in for. Again, I love the idea of preventative medicine in that way.
Too.
That's just not what people actually come in for. And they come in hurting and they want to get out of pain. And I think that the approach that I've developed, over just born of witnessing patterns in people who are suffering in this way over many years, has helped people, and that translates.
Yeah. So, and do I gather that you're also starting to create some kind of products as well around what you're doing with naturopathic medicine?
Yeah. So again, I've been in practice for 20 plus years, and I started my practice with the idea that I wanted to be a busy naturopathic doctor who owned a multi-doctor clinic, and that was the goal. And
Yeah.
then I'm really grateful and proud that it didn't take too long to achieve that goal, right? Like a
Yeah.
busy practice, multiple doctors, grateful patients, the whole thing. And as a busy-minded individual, I just sort of felt like I was bumping up against some limitations. My practice was booked out. I couldn't see any more patients. Otherwise,
Yeah.
I'd
Yeah.
run the risk of burning myself out. I didn't love the idea of like opening up more and more clinics and hiring more and more doctors. And so I just kind of wanted to expand my reach. And so that's when I started like creating content. This is probably about 10 years ago, online in various forms, writing. And then that parlayed that into creating products. And yeah, now I am the co-founder and the medical director of a company, products-based company called Up Wellness, which is named after an oceanographic, a surfing phenomenon. I told you I'm a surfer.
Oh, that's right.
Yeah, and we make products. Our flagship product is called Golden Revive Plus, and it's based on the herbal formulations that I would use in my practice, and that approach to musculoskeletal pain. Of course, this is herbal medicine for the masses, right? This is very different than treating an individual person. But
You're
there
right.
are some patterns that
Yeah.
that are pretty predictable, and there's some approaches, and we can talk about that more specifically. But yeah, Up
Yeah,
Wellness has
I'm
grown
curious.
to,
I'm curious to hear
yeah,
what kinds of, because I think again there are some general things that I think we know from these kinds of patterns. I'm same as you. I'm always looking
yeah,
for what that is, and what you can sort of build into your work. Like for movement work for me, I think most people need to learn how to stabilize their trunk and their shoulders.
mm-hmm.
Once they know how to do that, they can build their body and develop fitness. It gets skipped in just about every exercise program that I see.
Yeah.
So, that's kind of my approach. But so from a function, man, I guess this is not exactly functional medicine, but from a naturopathic medicine standpoint, what are those kinds of things that we could all probably use support with?
Yeah, so that I think that's a great question, and that what when people have musculoskeletal pain, and that means they probably have a diagnosis of like arthritis somewhere, or maybe it's just a pain syndrome in their back or their neck or their shoulder, whatever the case may be. In many cases, these people have been diagnosed with something structural that is visible on an X-ray or an MRI, like arthritis or a bone spur or a
Okay.
meniscus tear in a knee or a labral tear in a hip
Yep.
or a bulging disc in the spine, right? This is extremely common. And one of the things that I've learned, and I know that you know this too, is that what we see on those images is only part of the story. In fact, those images
Yeah.
are very often very misleading and lead to all kinds of unnecessary or inappropriate interventions, including
Yeah.
surgery.
Yeah.
And so it's really important for people to understand that just because you have a lumbar disc herniation, a bulging disc in your back or neck, or a meniscus tear in your knee,
Yeah.
that does not mean that you will have pain. There are lots of people who
Yeah.
have bulging discs and meniscus tears who have no pain at all. There's lots of people who have degenerative arthritis in any number of different joints who have no pain at all. But as soon as we see it on an MRI or an X-ray, we get all excited and say, "Oh, you need surgery, you need an arthroscopic, whatever," right?
Yeah.
So it begs the question. I'm just sort of rephrasing your question. Well, then what is it, right? If it's not the
Hmm.
disc that hurts, if it's not the meniscus that hurts, what is making my knee or my back hurt? And I'd say I'd put in four buckets, and let's talk about each one. The first one is excessive inflammation, more inflammation than there
Yeah.
should be
Yeah.
given the stimulus. And I think it's really important to call it excessive inflammation because people think inflammation is just bad. We should just stomp it out and put out that fire, but you
Right.
can't. Inflammation is necessary. It's a
Yeah.
biological imperative. So
Yeah.
more inflammation than you should have based on whatever the stimulus is. That's one problem, number one. Problem number two is some kind of muscular imbalance, often a strength to flexibility ratio imbalance. You
Yeah.
probably have another name for that, but too much
Yeah.
tension or not enough, something like that,
Yep. Yep.
and
We
that
call it tone. I mean, it's
sure.
one of the problems I found that I had myself was that I have a ligament laxity issue.
Mhm.
And that's, it's congenital, and it tends to be in certain populations of like Northern Europeans. That's one of those things. So if you meet a dancer, exactly. I mean, I'm just completely gummy. I mean,
We
my
yeah, we could do some finger tricks right now. I have it too. I'm
so
well acquainted with it.
that's a pretty common thing that I see in my practice. But yeah, I mean, tone is definitely one of them.
Absolutely. And in your case, this is a great point that you brought up. If you have ligament laxity and those joints are basically unstable as a
Yeah,
result of that, then the stability needs to come from somewhere. If you don't have joint stability, you run the risk of actually having a more serious injury, right? You can't have
yeah,
your bones slipping like that. And if they are slipping, or if there's a sense that there's instability, your brain and your body will react in such a way to try to stabilize that, much in the
yeah,
same way that an orthopedist would stabilize a fracture with a splint. So
yeah,
you'll put on a splint, of muscle tension or trigger points in various areas, and that splint will provide some stability. But if you have sufficient strength, core stability, or stability and strength in the muscles around that joint, a lot of times that splint you can loosen the Velcro on it, right, a little bit.
right,
And so
right.
so I think that's where I find that a lot of people have excessively tense or tight or spasmodic musculature, which is a big driver for pain. But the reason for that is because they had underlying instability and then subsequent muscle spasms as a result. So when you
Right,
apply added strength and core stability, they can relax
right.
and not be as unstable. So that's I think bucket number 2. We had excessive inflammation and then muscle tension.
Yeah,
And then another one I'm sure you're well acquainted with as a craniosacral practitioner is fibrosis, right?
right.
Uh, Either micro or macroscopic accumulation of scar tissue or fibrin
Yeah,
in the fascia, in the muscles, in and around the joints itself, and that can restrict blood flow. That can restrict, range of motion. It can entrap nerves and cause all kinds of problems as well.
yeah,
That would be bucket number 3. And then bucket number 4 is, we alluded to this before, is just psycho-emotional, right? The stories that we tell ourselves about this pain,
yeah.
what it means for our future, where it stems from, all of that stuff that is unique to each individual. It's very hard to bottle up to create a formula that encapsulates that. I think the
Right.
first 3 buckets I can cover pretty well with herbs and nutrients. That last one is tricky.
But I imagine you have to include something that does affect that autonomic nervous system, right? Because inflammation is one of those things. Like as you're saying, we need it. It kind of, when we
Mm,
have an acute injury, it kind of casts that area so we don't use it, right? It kind of tells us like, don't move this joint.
yeah.
But obviously too much of it, or excessive inflammation that doesn't stop being produced, and we know that to some extent that's also due to that sympathetic fight or flight response, that the body is overreacting to all sorts of things, right? It can overreact with histamine, inflammation, lots of stuff. So that's another part of this. And with my system, the craniosacral system, I like to try to remind people, is really that it's the dural membrane system, right, that houses the nervous system, but it's really connected more broadly to our whole fascial system, our connective tissue system. So because it's innervated, it is also going to react to our different states. And so this is one of those things when there is an injury cycle happening, especially if it happens during like an incredibly stressful time period, or where there've been a prolonged, stressor for you, or a childhood trauma or something. Our body's tendency to sort of go into those states is elevated as well. So
Yeah.
this is where I think some supplemental support, something like, I don't know what it is in your field, but I know like ashwagandha gets used a lot of times because it does bring some of that down. I don't know if that's one of your herbs, but
Yes, we use it regularly, and it's in many of my formulas. You just reminded me too, and you've probably had this experience as well. When you as a practitioner, I know it's happened to me many, many times. Apply a release technique, whatever that release technique may
yeah,
be. It may be a craniosacral technique. It could be acupuncture. It could be a chiropractic type of adjustment, or a deep myofascial release. A lot of times, those emotional things are kind of, I don't know, poetically wrapped up in that
absolutely.
complex, right? And so I've seen it countless times where I'm
Yeah,
like working on an area, allowing that very physical release to occur, and
yeah,
then a person has an emotional release, which can be all over the map. Sometimes
yeah,
it's laughter, sometimes it's tears, sometimes it's
exactly.
fear, and
Yeah,
and
we're
it's
trained in working with all that stuff too. So we do a lot of dialoguing work around that, trying to
yeah,
get a sense of what this may be related to, so that we can also kind of document it too, so we know
Yeah.
later on, like in this part of the body this came up with. That's
Yeah.
an important bit of information for us.
Absolutely, and that's a very, very real effect. And then, yeah, these herbal things you mentioned, ashwagandha. Ashwagandha is a prototypical adaptogenic herb, and it's we've probably heard this word adaptogens. It's really interesting, actually. The term is, I don't know, it's a little nerdy. What does it really mean? It helps the body adapt to stressful situations.
Yeah.
I think there's something cosmically cool about a lot of these adaptogens, including ashwagandha, but the
Yeah.
list goes on. Rhodiola, eleutherococcus. Many of these plants grow in stressful environmental conditions, right? And so, like, it might be very cold, or it might be very dry,
Oh, that's
stressful
interesting.
environmental conditions. And so, when a plant is in a stressful environmental condition, it can't, like, go get a sweater, or
Yeah.
like go move somewhere warmer or get water. It has to deal with that, and it deals with that through chemistry, right?
Right.
This is biochemistry, phytochemistry, plant chemistry. And it turns out, and this is the magic of adaptogens, that many of the very same compounds, right? The salidrosides in rhodiola, all these terpenes and whatnot, all these phytochemicals inside plants that allow plants to survive in stressful conditions, have a parallel effect in humans, allowing humans to also tolerate stressful conditions better. Maybe it's cold or altitude or dehydration or these sorts of things. So I think it's really magical in that way, that adaptogenic herbs have been evolved under stressful conditions, and they are there for us. The chemicals in those plants allow us to better adapt to stressful situations as well. And we use them regularly in clinical practice for exactly that reason.
So to dork out for just a second on this chemical process,
Yeah.
because I have to always go here, but that's a really curious thing. But if these plants are learning, right? There's an intelligence that they've learned over a long period of time.
Yeah.
When we introduce them to our system, is there sort of a chemical, education that goes on with our cells? I mean, how does that work?
I love this geeking out, by the way. This is great. I mean, this is just, I didn't expect it, and I'm thrilled, right? I think the answer is yes, that there is a relationship that we have with these plants. And I think, but it's a cautious yes, because we don't always know the exact nature of the receptor,
Right.
And the ligand interaction. But there's many examples of this. And some of the biggest research in this area, although it's not a prototypical adaptogen, is happening with cannabinoids from cannabis, right? This is a plant.
Right.
A plant also, it's a plant medicine. I'm not into, like, getting into talking about 420 and all that stuff, but, like, to me, cannabis is just an herbal medicine, just like ashwagandha,
Yep.
just like chamomile, right? But it turns out that because of its psychoactive effects, it's become people get really into it, right? And we've really studied it a lot. We grow it really these special and unique ways, and we've learned a lot about the cannabinoids themselves, all the different cannabinoids and the way they interact with our receptors in our brain.
Right.
And it turns out that there are specific receptors in our brains and in our nervous system. In fact, we have the system called the endocannabinoid system, the ECS, that is specific for the compounds in that plant. Right. So if we have receptors in our system that are expressed by proteins in our, mediated by our own DNA for a specific compound, cannabinoids inside of a plant, that means that us and that plant have been hanging out together for a very long time.
Exactly.
Right. Yeah. And I have every reason to believe that same situation applies to ashwagandha, rhodiola, all the other plants that we're talking about.
That's what I was wondering. That's cool.
Yeah. And there is evidence. I mean, as when you dig deep into the data of turmeric, for example, or many of the turmeric also has adaptogenic effects as well. We see that, yes, these things bind to very specific receptors with very specific and predictable outcomes. And so, yeah, we have been hanging out with these plants for a really, really, really long time. And that which they have learned, and I put that in quotes, air quotes, does seem to convey to us in many cases, making them just, beautifully well-tolerated medicines.
Right.
Yeah.
And it's interesting too, because I just had a conversation for the podcast not too long ago about some of the some of the products that are being developed around that are NA non-alcoholic products, and we're starting to include a lot of these adaptogens and things into those, and to me it makes sense. I mean, what people are oftentimes seeking, and I think people are now, of course, because I don't know if it's legal in Connecticut, but it's become legal in Minnesota. It's become legal in a number of places. Cannabis is basically kind of getting used in a way that I don't agree with because of the quality of the product, for one thing, and also because of the dosages. People just have no idea what combination of CBD to THC and what strains and what kinds of things they're using. We really do need better guidance with that, but I think there's a space wide open right now to fill in for where alcohol has filled in again, where I think we're trying to use these different substances a lot of times to to do something to our autonomic nervous system, right? We're trying to bring back that balance for ourselves, and obviously these things can get abused. But I feel like there is a wide open space for the adaptogens in that market too.
100%. Yeah, we're seeing a lot. I'm seeing this a lot too. Even one of the big ones that's making itself known now is kava. Piper methysticum is the name of the plant. Traditionally used in the Polynesian islands as a social lubricant, kind of has alcohol-like effects, calming anxiety, improving sort of sociability. And now we're seeing kava products, kava bars showing up all over the place. And so, and yes, you're right. People are seeking, they're seeking something, and they're starting to understand that maybe the things that we've used traditionally, maybe like alcohol and other substances, are maybe not the best choice. And yes, it's wide open, but there's also, I think there needs to be a certain respect, right, for the traditional use of these plants. And it's really interesting. I mean, I'm in a unique position because as a formulator and a medical director of a nutritional and herbal supplement company, part of me looks at these herbs in their traditional uses, right? In the way that the herbal medicine men and women, use them traditionally, often whole plant extracts used as teas, root, stem, leaf, berry, the whole thing. And then you compare that against the high scientific version where we take the root, for example, of a plant, extract out the so-called active ingredient, concentrate it, and then deliver it as a pharmaceutical effect. And I think that there's a place for both of those, right? I think there's a place for that traditional use, that sort of more gentle of the earth use of the herb. And then there is also a place for herbal medicine in a more high-tech, sci-fi kind of way. And I think they both fit into what I call a hierarchy of therapeutics, right? Like the lowest rung would be like movement and diet and good sleep and that kind of stuff, low rung interventions, and then move up from there to like tea, this is traditional use herbal medicines or vitamins or minerals, then up from there to maybe more concentrated pharmaceutical doses or extracts, and then up from there and we could keep on going up all the way to a hip replacement surgery, right? About as invasive as it gets. And in my view, all of those things are medicine, right? But they should just be used in a methodical way, as long as you don't have a compound fracture and you need the surgery right away, right? So that's my take on it.
Right. But when I got into my field 25 years ago, I saw everybody was getting a laminectomy all of a sudden, right? We went from we didn't start at the base with some movement and some things. We just jumped right to surgery.
Exactly. Yeah. And it's amazing because and they're still getting lots of unnecessary laminectomies, by the way.
I know.
And they've added the microdiscectomy to it, and it's really intense. And I mean, I talk about this all the time, the rampant practice of unnecessary and inappropriate surgery. And it's like a lightning rod, because there's one group of people who are like, go doctor, stick it to them. They're doing unnecessary surgery, big pharma, blah, 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 right? They're after the money. And it's true that there are hundreds of thousands of unnecessary surgeries performed in this country every year on spines, necks and backs, on knees and hips as well. And there's been lots of studies. This isn't a naturopathic medicine thing. This is just a scientific, well-validated fact. But then there's also people who are like, I had a back surgery or a hip surgery, and it was the best thing I ever did in my life, you know? And where I'm coming from is, look, both of those things can be true.
Yeah.
You can have a great surgical outcome and a perfectly appropriate surgery that's almost miraculous what we can do now. And that same surgeon can be doing hundreds or even thousands of unnecessary procedures per year. Both of
Absolutely.
those things can be true, and they both are.
Yeah. And what I try to remind people too, because I get a lot of people who are like on the fence about whether they should do surgery or they've been given a diagnosis and not sure what to do. There's a lot of room within movement and physical therapy to test that and to see if you can, manage to get out of this situation without it. And worst case scenario, you still go to surgery and you've improved your potential health outcome, because going straight from having back pain into surgery is not going to necessarily solve the problem, because usually there's a lot of neuromuscular imbalance going on in the system, not to mention stress triggers and all these other things that are probably, contributing to it. So I always try to lead people into like, let's start building a lifestyle part for you, before you decide to do that. And maybe at the end of the day, and sometimes, I'll work with somebody for 10 years with a cranky hip that, it was bad when they came to see me. We got it better for a while. And then the degeneration is just too bad. 10 years later, they end up having to have hip replacement, but they've done so much work that a month later, they're walking around almost normal again. Their muscles are strong and, prepared for that kind of shift to happen too. So
yeah, they did prehab, we call it, right?
That's exactly.
And they also did something more than just the physical prehab. They did the hard work, and now they can go into that surgery feeling confident that they exhausted their other options before, because I'm sure a lot of these people require quite a bit of I don't know what to call it, hand holding or emotional support, because many of these folks, especially in the alternative medicine world, they're really scared of surgery. That's part of the reason why they came to you or me, is that they don't really want that. And then if it becomes clear after working up those other rungs of the ladder that surgery is something they need to do, then it's really important for them to be able to go into a procedure like that feeling confident that they did everything else that they needed to do. They're appropriately prehabilitated, right?
Totally.
And that they're going to go in there confident that they're going to have a good outcome. And I've walked many people down that path over the years. And look, a well done surgery in competent hands in the right patient population who's an appropriate candidate for that surgery, it can be a beautiful thing. And we should be thankful that we have it. We shouldn't overuse it and respect its power as a tool. That's where we've gone astray.
And a lot of that is, I think, and this is, I'm sure you do a lot of this too, is that people feel disempowered though, or they have been by the system, or just by not being educated, or it should be something that we learn a lot more about, which is part of my doing these podcasts too. I think people can get these concepts. This is not so challenging most of the time, but I feel like that's kind of where we need to start with this, is really saying, I want to understand how to take care of my body. This is all I have. And I just want to be able to go and do all the things that I want to do without being hindered by physical problems or pain or anything. So that's where I'm always trying to like encourage people.
It's such important work. And it is true. It's an education piece. And I think a lot of people, going back to the example we used earlier, where I've seen this so many times, and it's really such a compelling story, where a person has a pain in one knee, let's say.
Yeah.
And an orthopedist will often get x-rays of both knees in that situation, just to establish a baseline. So let's say the right knee hurts, and then we get x-rays of both knees. And often what we see in that situation is that both knees look equally bad, right? Like there's arthritis or something, some kind of meniscus, whatever it is, that's bad on both sides. But again, only the right knee hurts. In that situation, in a conventional orthopedic office, very often that right knee will become a candidate for surgery. They'll want to do an arthroscopic debridement of the meniscus. They might want to replace the joint. But the question in the patient, or even if this has ever been an issue for any of your listeners, is like, why doesn't the left knee hurt if it looks just as bad as the right one?
Exactly.
Because
Exactly.
it can't be what we're seeing on that x-ray. And I
Yeah.
think it's a disservice to the patient when an orthopedist says, see, we see it on the x-ray, and not
Yeah.
address the elephant in the room, which is that why doesn't the other one hurt? They might just say, oh, I don't know why it doesn't hurt. I'm not sure, but there are some real questions there. Hopefully we in our conversation got to the root of some of those questions, because that's where the answer lies, that drives the pain and can
Yeah.
very often eliminate the need for those surgeries.
Yeah.
So that's
Yeah, and I think
important
we
stuff.
just quickly on that, we've gotten to a point now where the patient's expecting an answer, so much so that the physician feels like they need to give them something, to give them something solid. And I think you and I probably exist a little bit more in this area of, I don't know exactly, but we're gonna figure it out,
Yeah.
and we shouldn't be able to. I mean, I think most problems are not things that you can figure out almost immediately. And this is one of those things. I have one more topic. If we, I know you probably have to go shortly, but
No, we're
there's
good. I'm okay. Yeah.
there's one more thing that I feel like sort of relates to this that I've been wanting to ask somebody like you for a while. So I feel like one of the things I'm seeing in my office right now is challenges with fatigue. And I have a feeling this may relate to some of the product stuff that you have too, but I feel like it's, again, this struggle with fatigue a lot of times is there's not going to be one single, you're not going to be able to do some testing on me and say, oh, we found one thing, you're short on this, and here you go, and you're done.
I
There's
love it when
usually,
that happens. I love it when that happens. And it's happened like twice in the last 25 years.
right.
Yeah. Yeah.
So, we're looking to build up this base as we kind of keep talking about. And are there things that you're seeing, I guess? And I think some of this fatigue is coming from, 3 years of that we went through with the pandemic and recovery, and a lot of, social and economic, challenges for people. Is there, and just kind of the way that taxes our system? Are there things that you're starting to use more, or is this something you're seeing in your practice as well? And are there things that we can kind of build that base back up with?
Yeah, it's a big question. I'm definitely seeing it. I think anybody who's in healthcare is seeing this. Anybody who's on the planet is seeing it and feeling
Yeah.
it themselves. And I think, as you know, and you're right, it's always multifactorial. It's great when it's just B12 deficiency and you can just give them some B12 and
Right.
solve that problem. Or it's like maybe even sleep apnea or something like that, and you can
Hmm.
hopefully try to correct that. But people are tired and exhausted for all sorts of different reasons, and yes, there's many inputs that can affect a person's energy levels or the charge that they have in their battery. I think one of the main places to look is the HPAT axis, right? The hypothalamic, pituitary,
Hmm.
adrenal, and thyroid axis. This is the endocrine part of that
Yep.
immunoendocrinology piece, because the inputs that are coming in, that is the psychoemotional stresses, that is the poor diets, that is the toxic exposures, environmental exposures, all these kinds of things can damage the energy production capacity of our cells, which is from our mitochondria.
Mhm.
And then when those mitochondria fail to produce sufficient ATP, which is our cellular energy, we see all kinds of problems emerge, including issues with balance and modulation of the hypothalamic pituitary adrenal axis, right? The adrenal
Right.
gland is in
Right.
overdrive, cortisol stresses. We can get into the hormonal stuff another day, but
Yeah. Yeah.
and but I think that's the place where I look first. And it's interesting that you brought up the adaptogens earlier, because I think that this time is the time for adaptogens. I think these
Uh,
are the plants that are here. I mean, this sounds cosmic and woo woo, and I'm totally okay with that, by the
yeah.
way.
Yeah. Yeah.
Um, that these plants are here for us,
Yep.
and right now is the time when we need adaptogens more than we've ever needed them before, because they help to bring some balance back into that system that is so grossly out of balance. Yeah.
Yeah. Because I mean, we can work on all the base things. We know that sleep and diet and all those things are helpful. But I find even people who I feel like they're doing really pretty well with those things, they're still struggling to get that base back up.
Yeah.
So that's good
Yeah.
to know.
I have to point out too that for a lot of these people, even if it's not really obvious or on the surface, there's a psycho-emotional piece as well, which is
right,
usually, I mean, for lack of better terms, it's usually some component of depression and or anxiety
right,
that are on top of that. And listen, there's lots of things to be depressed and or anxious about these days.
right.
Certainly what we've just been through and the state of the world and whatever, so
Yeah,
and it's not always so obvious and on the surface like
yeah,
that, but
yeah.
I would say that almost always in a fatigued person, when we start to kind of get into it, we can find that there is some of that as well, and that needs to be
Agreed.
addressed also. Yeah.
Agree. That's a good reminder. Well, Josh, this is so fun. Like, we could go on for hours.
Yeah.
We'll come bring you back and we'll do something maybe a little bit more narrow and topic specific. But I just wanted to get you out there introduced as well.
Yeah. Well, this was fun. This is right up my alley. Like you said, we could talk about these sorts of things, and we just scratched the surface of some of the issues. So we'll have to do it again.
Okay,
Yeah.
sounds good, man. And I'm excited for you to start your podcast. So you have
Yes.
to let us know.
Yeah.
I'll make sure we include some links.
Yeah, absolutely. I'm excited for it too, and I'll look forward to bringing you in. The idea there is that there's medicine everywhere, right? This
Yeah,
idea of that spectrum, right? That like that drugs can be medicine and diet can be medicine, and supplements are medicine and surgery is medicine. Reiki,
yeah,
radiation, chiropractic, chemotherapy. I could
right.
keep on going,
It's
right?
a spectrum. Yeah,
Yeah, it's a spectrum, and I think that we in this country overemphasize some of those things and underutilize others. And
yeah.
the idea is to bring in conversations and insights about all of them, and try to do that in a objective and not biased way. So
Yeah.
that's the idea. And craniosacral, right? Put that on the list.
Very cool, man. I
Yeah,
like it.
yeah.
All right. Well, I appreciate your time, man.
Right on. Likewise.
Thanks so much.
Yeah.